Dear students, welcome back. In the previous session, we have discussed about various attachments of the tibia on the anterior aspect as well as the upper end of the tibia. Now in this session, we are going to discuss about the attachments of structures on the posterior aspect of the tibia. So before we'll move on to the attachments, once again we will see the bony parts on the posterior aspects of the tibia. Okay, so with this we can easily understand about the attachments of the muscles. So in the posterior surface, normally the posterior surface lies in between lateral border and the medial border. Okay, and it is having on the upper end of the tibia, it is having a marked prominent ridge which runs downwards and medially. This is called as soleal line. Okay, and the part of the posterior surface, the above soleal line, is somewhat triangular in shape. Okay, and the part below the soleal line is further divided into medial and lateral parts by a faint vertical ridge, which is dividing into the medial surface or medial side on the posterior surface, and this one is the lateral part of the posterior surface. So why I am explaining this thing, because so in all these places some of the muscles are getting attached. So now we will see the attachments on the posterior aspect of the tibia. Yes, okay. Now we will see from upper end to the lower end. So in the upper end, it gives attachment to the semimembranosus. The semimembranosus muscle is getting inserted into the posterior and medial aspects of the medial condyle. Okay, and if you see on the upper end itself, it is giving attachment to capsules. Okay, one is the capsular ligament. We can call it as capsular ligament of the knee joint, or capsule of knee joint is attached on the posterior surface around this tibial condyles. A gap is present in between them. Here you can note that gap here. Okay, and also around the facet, it is also giving some attachment to the capsule of superior tibiofibular joint. Okay, now so here we have already seen here an oblique ridge called soleus line is present. So some of the muscles which are attached above the soleal line, on the soleal line, and below the soleal line, the shaft is divided into medial and lateral. So the muscle which is attached to the medial aspect, what is that muscle, and lateral aspect, what is that muscle, now we will see. So above the soleal line, there is a triangular area which gives insertion to the popliteus muscle. On the soleal line, it gives origin to the soleus, and below the soleal line, towards the lateral aspect, this one becomes the lateral, upper 2/3 of lateral side of the shaft of the tibia gives origin to the tibialis posterior. On the medial aspect, it gives origin below the soleal line, it gives rise to flexor digitorum longus. Okay, so these three muscles are getting originating, and popliteus and semimembranous are getting inserted on the upper end of the tibia as well as upper part of the shaft on the posterior aspect. Now we will see on the lower end. So this lower end will give a capsular ligament, that is capsule of the ankle joint around the articular surface of the lower end of the tibia. So that green color you can find here. Okay, and some of the structures which shows some relation on the posterior aspect, or a tendon from, we can see from medial to lateral, a tendon from the tibialis posterior, and two tendons from tendon of flexor digitorum longus, and another tendon is also tendon of flexor digitorum longus. All these are related on the posterior aspect of the tibia. Okay, and these are all the structures. And if you see the interosseous border, it gives an attachment on the lateral aspect, on lateral aspect of the lower end of the tibia, that is interosseous tibiofibular ligament. So these are all the attachments of the tibia on the posterior aspect. In the next session, we are going to discuss about another bone called fibula. Thank you.